Hi guys, my name is Becky Luther. I'm a nurse practitioner here at Ozark Regional Vein and Artery Center, and today we're going to be talking about common myths and misconceptions about vein disease. The most common myth or misconception that we hear about at Ozark Regional Vein and Artery Clinic is people come in concerned that we do vein stripping. So vein stripping is what your mom or your grandma or your aunt or your uncle had done many years ago. And it's a painful procedure. You're admitted into the hospital, you're put under general anesthesia, your vein is physically pulled out, you have large scarring, there's a high risk for blood clots, there was a high risk for infection, extremely expensive, long procedure that was done. If anyone tries to strip your veins today, you need to run the other direction. We don't do that at Ozark Regional Vein Center, and in fact, that hasn't been done in 15 or 20 years at least. At Ozark Regional Vein and Artery Center, the treatments that we do are all outpatient, meaning you come in, you get the procedure done, you go home and you live your life that same day. As a matter of fact, the longest that you'll be here at the clinic is an hour and a half. Another common misconception that we hear about at Ozark Vein and Artery Clinic is that nothing can be done for varicose veins. I can't tell you how many patients have come in to me saying, I've been to my provider over and over again over the last 20 years, and they said there's nothing that can be done for these large, painful, throbbing bulges in my legs, except for wear compression stockings. And quite simply, that's not true. There are so many procedures that can be done today to make your leg healthier, to make your leg feel better, to get rid of those horrible symptoms that many patients have been experiencing for decades. So some patients come to our clinic here at Ozark Regional Vein and Artery Center, and they want to get their visible veins treated. For instance, sclerotherapy. Sclerotherapy is an excellent method for treating those small spider veins on your leg that sort of look like someone took a blue or a purple pen and they drew lines on your leg. That's a spider vein. And some patients just want to get their spider veins treated. And in certain patient populations, actually, that's okay. They don't have any underlying reflux disease in their veins. We can treat their spider veins. They look better. They feel better. They go on their way. But in another segment of population, the patients that have deep venous reflux, to simply treat the small visible veins, we'd be doing our patients a disservice because the smaller visible veins are a symptom of a larger and deeper problem. Even sometimes the large refluxing varicose veins, they're actually a symptom of a bigger and a deeper problem that needs to be fixed before we address the visible. So if you have any more questions, if you have underlying issues or symptoms that you want to get checked out, call Ozark Regional Vein and Artery today. We'll schedule for your vein screening.